Such a pleasure to be back in my hometown and to get this warm welcome. So thank you all. I've gotten to meet some of you throughout the day. Really excited to be chatting more. And as Matt said, I'm going to be talking about some of our work on public policies to improve diet and reduce unhealthy thinking. I was telling some of the grad students earlier, you could also call this talk Why I'm the Fun Police. So I apologize if I ruin any of your fun today. But I know that as an epi department, you're coming potentially from many different fields, studying many different health topics. So I thought I'd tell you a little bit about what motivates me to do this work and how we approach it. And I'm going to start with some statistics that you might be familiar with. We know that unhealthy diet and alcohol are two of the leading causes of preventable death in the US. Together, they account for about 1 in 4 deaths every year. And that means we could prevent or delay as many as 700,000 deaths annually if we had better strategies for encouraging Americans to eat more healthfully and reduce their alcohol consumption. Unfortunately, we know that progress addressing these issues has been quite slow. So what you're seeing on the slide here is average healthy eating index scores in the US among children and adults. This is just a measure of overall dietary quality. It measures alignment with US dietary guidelines, ranges from 0 to 100, where 100 is the ideal diet. And you can see in no year are we doing better than 60 out of 100. So you students in the crowd would probably not be happy with that as a grade, right? That's a D minus. And despite some slight improvement from 2005 to 2012, we've actually seen some backsliding the last decade or so. So lots of work to do to improve diet. And the story, unfortunately, is not better for alcohol consumption. This is a graph of alcohol-related deaths, age standardized. And you can see that those death rates are increasing for both men and women from 2000 to 2016. And we know that this has only gotten worse since the COVID-19 pandemic. We also know that there are persistent disparities in diseases related to unhealthy diet and alcohol consumption. These are just two of many examples of what we see across race, ethnicity, education, and income, where Black and Latino adults and other racialized adults have higher rates of some of these diseases than white adults. This includes for some alcohol-related diseases where consumption is actually pretty consistent across population groups, but the consequences of the behavior unfold differently across populations. So these are population-level problems that are affecting hundreds of thousands or millions of Americans every year. And population-level problems can benefit from solutions that are also at the population level. So that's what gets me really excited about public policy, because public policy has two features that make it well matched to these problems. First, public policies have high reach, right? They can affect entire cities, states, or countries where they're implemented. And second, when we actually manage to pass these policies, they can create change that stays in place for a long time. So that is what excites us about policy. And for that reason, my research mission is to help policymakers implement policies that improve diet and reduce excessive alcohol consumption with the hope of trying to drive down some of these death rates. My lab, the Stanford Food Policy Lab, focuses on a number of research areas. We study food and beverage labeling policies, food assistance programs like SNAP, alcohol warning labels, sugary drink pricing policies, and now we're also doing some work on policies to promote sustainable diets. And today, I'm going to focus on just 2 of those, but if you are interested in the others, I'd be delighted to talk to you after. And specifically, I'm going to go into more detail on a few studies that address these 3 questions. First, can sugary drink warning labels actually change consumer behavior? Can they change what you and I buy at the grocery store or at restaurants? Second, can mandatory calorie labels spur product reformulation? Can they change what companies sell? And third, how should we design alcohol warnings to maximize their public health benefits? And throughout, I'll weave in some information about some of our ongoing and next steps in each of these research areas. All right, so diving into the first research area, I want to talk about sugary drink warning labels. Now, you might be wondering, our diet quality has a lot of room for improvement, as I mentioned earlier, right? We're never doing better than about 60 out of 100. So you might be wondering, why focus on just one dietary behavior? Why just sugary drinks when there's clearly a lot of room for improvement? The answer is twofold. First, sugary drink consumption is quite prevalent. On any given day, 60% of adults, of children and about half of adults consume sugary drinks. And second, sugary drink consumption is thought to be uniquely harmful. So randomized trials and epidemiological studies indicate that sugary drink consumption contributes to some of the most prevalent chronic diseases in the US, heart disease, type 2 diabetes, obesity, et cetera. So policymakers have really focused on sugary drinks as sort of a low-hanging fruit. It's sort of hard to argue against policies targeting these beverages. And certainly if we could reduce consumption, we'd probably improve health. So we're going to focus on sugary drinks for this next section of the talk. And a question that policymakers have had is whether warning labels could help address high sugary drink consumption. We already, 7 states here in the US have proposed requiring what are called health warnings for sugary drinks. These would look like the warnings we have on cigarette packs. So they would describe the health harms of consuming sugary drinks. The warning you see here is language that's been proposed in California, where I live now. If adopted, the policy would require sugary drinks to display a message that says, safety warning, drinking beverages with added sugar contributes to obesity, type 2 diabetes, and tooth decay. So again, connecting the product to a set of health harms. And internationally, 10 countries have already adopted warning labels for sugary drinks and other unhealthy foods and beverages. Other countries have taken a slightly different approach. They've adopted what we call nutrient warnings. These are warnings that signal when a product has an excessive level or a really high level of unhealthy nutrients like sugar, salt, saturated fat. So this is a Coke bottle from Mexico, and it says excessive calories and excessive sugar and these black stop sign shaped warnings. So if you travel in Latin America, you'll see these warnings all over the food supply, again, signaling when products are high in these nutrients. Now, when thinking about new labeling policies, I think it's helpful for us to consider the status quo for nutrition labeling in the US, and that is our friendly nutrition facts label. So you're probably all familiar with this, right? It's required on nearly all packaged foods in the US. But unfortunately, it is numeric. It is shown in small print on the back or side of product packaging. And a large body of evidence shows that most consumers have difficulty using and understanding this label. By contrast, warning labels are interpretive. So they interpret product healthfulness for us rather than only giving us numbers. They either tell us this product causes diseases, or they say this product is high in this unhealthy nutrient with a warning symbol or word. And they're also shown on the front of package, right? They're sort of mini billboards at the exact moment when we need information about product healthfulness. We don't have to turn the product around. We have to look for something that's harder to find. So in this way, warnings might provide easier to access information about nutrition and healthfulness than our current status quo. All right, so 7 states have proposed these health warnings specifically for sugary drinks. But until recently, there had been no randomized trials that actually examined whether these warnings changed behavior. So this was a case where the policymaking was out in front of the science. Policymakers were excited about this policy. We didn't actually know if it worked. So the objective of the study I'm going to tell you about next was to evaluate whether sugary drink warnings could actually change consumer behavior in a randomized trial. So to do this, we set up a naturalistic convenience store laboratory. This was a lab that was set up to look and feel like a convenience store. So we sold foods, beverages, and household items like toothpaste, soap, Band-Aids, things like that. This is one of our research assistants, Carmen, setting up the store. And we recruited a sample of adults to visit us in the convenience store laboratory, 400 adults, and we randomly assigned them to a warning label arm or a control label arm. In the warning label arm, we display these red stop sign shaped warnings on the front of all the sugary drinks in the store. So the Coca-Cola and the Mountain Dew and the Gatorade, we put these red stop signs directly on the front of the package. Before the trial, we did a series of experiments to understand how we should design these warnings to maximize their benefits. And we found that warnings with the characteristics down the center of the slide tend to be more effective than warnings without those characteristics. So our trial label adopts each of these features, as you can see here. And in the control arm, we also put a new label on the front of the sugary drinks, but rather than a warning label, we put this barcode image. So it's something that's already on product packaging. It's neutral. It's not carrying health information. So we're controlling for the act of putting this extra thing on the front of the package, but we're not otherwise intervening on behavior. So people come to our lab, they're randomly assigned labels on the sugary drinks, and then they shop for foods, beverages, household items, whatever they want to buy, and we record their purchases. The primary trial outcome was sugary drink purchases, which we measured in terms of calories purchased. And in the control arm, participants purchased about 143 calories from sugary drinks. So this is about the amount in a can of soda. This checks out. People in a convenience store, on average, they're buying about 1 can of soda worth of sugary drinks. And in the warning label arm, people are purchasing about 110 calories, so about a 22% reduction over the control arm. So this suggests, at least in this context of a lab that's set up to look like a convenience store, that warning labels can achieve the goal that policymakers had for them. They can reduce purchases of the product that's displaying the warning. So of course, there's lots of other questions we would have outside the lab, right? I was talking with Evan earlier, how does this affect total dietary quality? How does it affect other purchases? But we're at least getting an initial signal that this policy could change behavior. Warnings didn't work in this context. That might tell us they're not worth pursuing. We also looked at whether warnings had different effects across population groups that might be relevant for health equity. And again, in this particular sample, didn't find differences in warning effects by age, race, ethnicity, income, or education. So similar effects across population groups, at least in this sample. We then did a second study, this time with parents shopping for their children in a similar convenience store laboratory environment. And this time we used graphic or pictorial warnings. And again, saw that the warning labels achieved their intended goal. They reduced purchases of sugary drinks. And again, found no differences in warning effects across population groups. So similar pattern of results when adults are shopping for themselves and when they're shopping for their kids. Now, we might want warnings not just to work equally well across population groups, but potentially to have larger effects among population groups who are most affected by the diseases related to sugary drink consumption. So some work led by my colleague Marissa Hall has tried to explore whether adding icons or images to sugary drink warnings that would otherwise just have text helps them have more pro-equity effects. And what this work has showed is that adding icons to warnings that would otherwise just have text enhances perceived message effectiveness, which is a marker for actual effectiveness. And this effect is even larger for groups that have limited English use, that don't speak English often at home. So we're seeing that icons are good for everybody, and they're especially good if you otherwise might have language or literacy barriers to using the warning. So together, this trial work suggests that implementing sugary drink warning policies could reduce sugary drink purchases. Again, there's a lot of questions we still have, but at least in the context of these trials. And that includes effects among parents, and also suggests that adding icons to text-only warnings could be especially promising for both effectiveness and potentially for equity. So we've continued to work on translation and policy dissemination, including conducting a meta-analysis of experimental studies, which we undertook in part because policymakers are often asking us for meta-analyses. They're particularly helpful summaries of evidence. And the meta-analysis found, similar to our trials, that warnings reduce sugary drink purchases. So the meta-analysis plus some evidence coming out of Chile led my colleague Marissa Hall and I to write a commentary calling for warnings to be applied not just on sugary drinks, but across unhealthy foods and beverages in the US. So that's the promising piece of the warning label work, but I want to also talk about some of the challenges that we face in adopting these policies in the US, and those have to do with legal challenges due to the First Amendment. So warning labels are considered compelled commercial speech, which means that companies can challenge them on First Amendment grounds. Basically, if the government wants to require a warning, Coca-Cola or Pepsi can say, we don't want to have to put that on the front of our product packaging. That's our advertising space. You can't compel us to say that. Now, the government can require warnings. We have them on cigarette packs, but to do so, they have to clear some legal hurdles, including that courts must deem the warnings to be factual and non-controversial and not unduly burdensome. And these both have particular legal meanings that get sorted out typically in court cases. But the upshot is that sugary drink warnings have been struck down on First Amendment challenges. So in 2019, San Francisco became the first city in the US to adopt a policy requiring warnings on advertisements for sugary drinks. They would look like the warning you see on the bottom of the slide here. And that warning was never implemented because the Ninth Circuit struck down the particular language that the city had proposed for not clearing these two constitutional bars. So this has led to a shift in the policymaking landscape from health warnings that talk about health effects toward nutrient warnings like what's used in Latin America that signal when foods are high in unhealthy nutrients. And the thinking among legal scholars and advocates is that these nutrient warnings might be more likely to be deemed factual, more likely to clear these legal hurdles because you don't have to prove health harms. And as you all know in EPI, it's very hard to prove health harms for really anything. So there's been a shift towards these nutrient warnings, including that the FDA for the last year and a half has been developing new front of pack labels that they're poised to require. We'll see, I think if we get a new administration, that will not happen. But they have indicated their intentions to release a proposed rule requiring nutrient warnings for packaged foods. These would be front of pack labels that might look something like this. These are from the FDA's initial research into this topic. And at the local level, we've already seen some policies pass. So in Philadelphia, restaurant menus are required to display sodium warnings for restaurant meals that contain more than a day's worth of sodium. And in New York City, they require both sodium and added sugar warnings on restaurant menus. So at the local level, we've seen some success in moving towards these nutrient warnings, and those have not been challenged in court. So we're following the policymaking, and our next steps, we're also looking at nutrient warnings. This includes a trial that we're launching in just a couple weeks to evaluate the FDA's proposed labels, as well as some other popular front-of-pack labels. This time not in a convenience store, but in a naturalistic online grocery store. So we've developed a fake online grocery store. We call it Grocery Central. So we scraped a website, recreated basically like a Walmart.com, but we can manipulate which foods have what labels. So we're going to randomize folks to be exposed to the FDA's new labels or to other sets of front-of-pack labels, and then measure what they buy in this online supermarket. So stay tuned for that in the coming months. And then we're also really excited to get to evaluate a policy that's already in place, which is New York City's added sugar warnings. So they passed this last November. It's set to be implemented in October of next year. Again, this requires added sugar warnings on restaurant menu items that contain more than a day's worth of added sugar. And we've recently started a project to evaluate whether these warnings actually reduce added sugar purchases, which we'll do with a quasi-experiment combining location-based receipt and survey data collection. So we're partnering with an app that sends people surveys based on their geolocation, so we can survey them as they're leaving restaurants. And then we're really lucky to be getting the universe of transaction data from Taco Bell. The Taco Bell's nationwide, so we're going to know everything that people buy at Taco Bell in New York City, and of course places that don't have these warning labels. So I think between those two data sets, we'll have a really nice, rich picture of how consumers are responding to these warnings. All right, so sugary drink warnings we think are promising for changing behavior, and we're seeing some traction moving towards nutrient warnings in the policymaking space. I want to turn next away from the consumer side and towards the supply side and think about whether implementing menu calorie labels can influence product reformulation. So this section of the talk is going to refer to something that we in the public health world call prepared foods. So prepared foods are foods that are ready to eat and that we usually eat on site or soon after leaving. So think of like restaurant food, basically. Prepared foods account for a third of our daily calorie intake and are considered to be a public health concern because they tend to be higher in saturated fat and sodium, lower in fiber, iron, and calcium, and served in larger portions than the food we make for ourselves at home. Now, I told you just a second ago to think of restaurant food, but it turns out that supermarkets are also an important source of prepared foods. About 90% of supermarkets in the US sell prepared foods, and sales of these foods are growing faster than overall supermarket sales and than restaurant sales. So think of like the hot bar at Whole Foods. This is like a really popular thing in supermarkets now. Unfortunately, while we think of supermarkets as a healthier place, it turns out that the prepared foods they sell are very similar nutritionally to restaurant foods. So supermarket prepared foods are no healthier than what you would get from a typical restaurant. So the question we're going to ask next is whether calorie labels could help address prepared food consumption. Now, we already require calorie labels on packaged foods via the nutrition facts label. That's been true since the mid-90s. But until recently, there was no similar requirement that retailers post the calorie content of their prepared foods. That changed with the 2010 Affordable Care Act, which among many other provisions also includes a requirement that food retail chains with 20 or more locations display labels showing calorie content of those prepared foods. And that law applies to fast food restaurants like Chipotle, to full service restaurants, and to supermarkets that sell prepared foods. When policymakers wrote this law, they mentioned two goals that they had for it, or two ways that it could improve population health. One is that it could change consumer behavior. So consumers might buy foods with fewer calories when they know about calorie content. And the second is that it could potentially spur companies to change the types of products that they offer to spur product reformulation. We've had a number of studies that have looked at effects on consumer behavior. It seems like these calorie labels lead to small but persistent reductions in calories purchased from restaurants. But we've had many fewer studies looking at product reformulation, and none had been done in supermarkets, despite the growing importance of supermarkets as a source of these foods. So the objective of this next study was to examine changes in calorie content of supermarket prepared foods after supermarkets were required to post calorie labels on these foods. We did this work in partnership with two large supermarket chains located in the Northeast, Mid-Atlantic, and Southeastern US. They're composed of about 1,200 stores in those regions. And these two chains implemented calorie labeling for prepared foods in April 2017 in anticipation of the federal mandate becoming effective. The chains provided us with nutrition information. In total, they gave us 8 time points or 8 repeated cross-sections of data. Each of those data sets had a census of all the products they were selling across their stores with nutrition information about each of those products. So basically, we know all the products that were on the shelves at each of these 8 time points, 4 of which were before the chain started labeling, and 4 of which were after the change started labeling. So in total, it was about 480,000 observations from about 90,000 unique products. So we took those products and we identified the prepared foods that would be subject to the new calorie labels. So in supermarkets, this is foods like fresh baked muffins, hot pizza, and anything sold at the hot bar. So these are foods that would be newly required to display a calorie label because of this Affordable Care Act mandate. And then we also identified comparison foods that were similar to these prepared foods, but that were not subject to the new calorie labels because they were packaged and so already had calorie labels. So think of things like packaged muffins, frozen pizzas, and meal kits, foods that were similar to these prepared foods, but not subject to our intervention. We also stratified these foods into 3 different food groups, which we hypothesized based on our conversations with the supermarket chains might respond differently to calorie labeling, where we might see different effects in terms of reformulation. We look specifically at bakery items like muffins, entrees and sides like rotisserie chicken, hot bar foods, et cetera, and then deli meats and cheeses. So like sliced turkey by the pound, sliced cheese by the pound. So our analyses ask, did implementing calorie labels lead to lower calorie content among prepared foods relative to changes in these comparison foods that did not have this intervention? The primary analyses I'm going to describe first focus on what we call common items. These are items that are available at all 8 time points in our data set. So you can think of them as things that are more core to the supermarket's business. They're always on the shelf year over year, month over month. And we focus on these because our sample size of these is bigger and because we can follow the same products over time. So what we're seeing is like true product reformulation, changes to an existing UPC. Talk about new items in a second. And we implemented our analyses with a difference in differences approach. So we're going to look at change from before to after labeling among prepared foods relative to change over that same time period in our comparison foods. So looking first at bakery items, what you're going to see here is calories per item on the vertical axis and then time on the horizontal axis. And you can see in the pre-labeling period that prepared items in the orange triangles are a little bit more caloric than comparison items. And that for both prepared and comparison items, we have pretty stable trends in the pre-labeling period. So again, these are products that are on the shelf year over year. We're looking at the same products over time. They're not changing their calorie content. This makes sense. Consumers have expectations about these products, how they taste. Companies aren't reformulating them much. After labeling, we see this little dip in the calorie content of prepared foods and no change in the calorie content of comparison foods. This gives us a difference in difference estimate of about -8 calories per item, which is a 0.5% reduction. So a really teeny tiny reduction in the calorie content of prepared foods, which is probably not clinically meaningful, but you can see it's statistically significant. So small reduction in calorie content of bakery items. When we look at entrees and sides, we do not see evidence of reformulation. And if anything, the direction of the effect is the other way. It's a slight increase. And same thing for deli items. We get a different diff of basically 0. So we're just not seeing a lot of movement in these common items. Companies are not seeming to reformulate them when they're required to disclose calorie content of the items. In exploratory analyses, we looked at new items because we know that companies could also introduce new lower calorie items after they're required to label their products. So they might say, we don't want to change our existing products, but we'd like customers who are calorie conscious to have some lower calorie option available to them. This was exploratory because our sample size of new items is much smaller. It's about 1/10 the sample size of our data set of existing items. But we wanted to look at it because we thought this might be a way companies would respond to calorie labels. So we implemented a similar difference in differences approach with these new items. So I'm going to show you the different diff estimates in this table here. So first, what we see is that the median prepared bakery item after labeling has many fewer calories, about 440 fewer calories than prepared bakery items before labeling. And this is net of changes in comparison items. So we're seeing big reductions, about a 25% reduction in calorie content of new bakery items. So they're introducing lower calorie things after labeling. For entrees and sides, again, we see the opposite direction of effect. This is not quite statistically significant. And for deli items, we see a reduction that is also not statistically significant. But you can also just see there's just a lot more movement in these new items. Like they're just introducing a lot of stuff, and there's more changes in the calorie content of these items relative to what we saw in the common items. We also conducted similar analyses looking at 59 large chain restaurants from 2012 to 2019, and saw a very similar pattern of results where we're seeing basically no changes in the calorie content of common items that are offered year over year, and then this reduction of about 25% calories and the calorie content of new items. So it seems like companies are resistant to changing products about which consumers have strong expectations, but might be more willing to offer new lower calorie items after they're required to disclose calorie content. So this quasi-experimental work suggests that calorie labeling for prepared foods might encourage reformulation for some types of products. There's more movement for bakery items, especially new items, which, if true, would mean the benefits of food labeling could extend beyond their effects on consumer behavior. So if we're removing some calories from the food supply, that might lead consumers to eat fewer calories, even if they're not noticing or using calorie labels. But if our goal is to spur product reformulation, we didn't see it for a lot of the categories we looked at. So we might want additional policies if that's what we're seeking out. Do you have a question? Yeah.
Well, yes. But okay, so no change in product formulation, but does your data show a change in purchasing, in consumer behavior?
Yeah, so that's not in these slides, but we did look in the same, we only had purchase data from one of the two supermarket chains, and we see a small, about a 2 to 4% reduction in calories purchased across these three product categories after calorie labels were implemented compared to before. And it doesn't seem like people are shifting from the prepared foods to the comparison. So they're not buying more packaged muffins when they buy fewer fresh muffins, they're just buying fewer muffins. So it's a small effect, but you can, in the sales data, you can detect it because the data sets are so big. And that's consistent with what you see at restaurants. It's sort of in the 2 to 5% reduction range. Also happy to take other questions along the way. Okay, so I told you at the start of the talk that alcohol consumption is also a leading cause of death. So I'm going to shift now from talking about interventions focused on diet quality to thinking about alcohol warning labels. Now, in addition to alcohol being a leading cause of death, we also know that about 1 in 3 adults in the US exceed recommended levels of alcohol consumption. So prevalence of excess consumption is actually, in my opinion, surprisingly high. And this might be in part because many adults are not aware of alcohol's harms. So we all know not to drink and drive. We all know about avoiding alcohol during pregnancy. But many adults, for example, are not aware that alcohol increases cancer risk, even though alcohol has been categorized as a group 1 carcinogen, the same group as tobacco, for many years. About 50 to 80% of US adults don't know about that link. This has led advocacy groups like Center for Science in the Public Interest, Consumer Federation of America, to call on the Surgeon General and others in leadership in the US government to require new labeling for alcoholic beverages, to inform consumers and try to drive down prevalence of excess alcohol consumption. Now, we actually already have health warnings on alcohol containers. Not everyone knows this. So a little audience break for you. Tell me if you can find the warning label on this beer can, which my colleague Marissa Hall took of an IPA in her patio in North Carolina. Can anyone spot the warning label on this beer can? Not a trick question, I promise.
It runs north to south in a small font.
Yeah, so it's there. It is just, I think it's easy to see from this picture. I hope you'll agree that it is not the very best designed warning we might come up with. And in fact, we know that the current warnings required in the US do not follow best practices for warning design. So they're shown on the back or side of product packaging, even though we know that front of pack warnings are more effective than back of pack warnings. It's got this long, hard to read message. I reproduced it over here. It's 2 sentences. It's got all these phrases. It's not easy to digest when you're trying to make a decision quickly about what to buy. It's also text only, even though we know that warnings with icons or graphics are more effective than text only warnings. And we've used the same message since 1989 when this warning was first required. So we haven't updated this message, even as the science of alcohol harms have changed. And even though we know that rotating the content of messages over time enhances efficacy because it prevents any one message from becoming stale. But we could require new warnings. So we could require warnings that are shown on the front of product packaging instead of the back, that use a simple, easy to read message, that include an icon or an image, and that rotate their content over time to prevent any one message from becoming stale. And the good news is there is a regulatory pathway, a pathway we can take not through Congress, but through regulation that would allow us to update the health warnings for alcohol. And that pathway is through the US Alcohol and Tobacco Tax and Trade Bureau, or for short, the TTB, which is part of the Treasury Department. They regulate most alcohol labeling in the US. So they're the ones that mandated the original alcohol health warnings, and they have the authority to update those if the science justifies doing so. Now, there are some questions they might want to answer if they were to adopt new alcohol warnings. One question, for example, is what health harm should new warnings address to most motivate people to reduce any unhealthy drinking? So the current warning talks about fetal harms, right? Drinking during pregnancy increases risk of birth defects, and impaired driving, impairs your ability to drive a car, operate machinery. But what if the warnings instead talked about cancer or liver disease or trouble sleeping? Would these harms be more motivating to consumers, be more likely to cause them to reduce their alcohol consumption to a healthier level? A second question we might want to ask is about a term called psychological reactance. This is basically message resistance. So the theory of psychological reactance is that sometimes when people hear a health message, they feel like their freedom is being threatened. Don't tell me what to do. So instead of following the orders of the message, they rebel. They do the opposite of what the message suggests. So our friend here is a good example of this. He's smoking directly beneath a no smoking sign. Maybe he's feeling particularly reactant or particularly resistant to the message. And of course, if we're seeing warnings elicit a lot of reactance, this could undermine some of their benefits because we're going to have some people who are doing the opposite of what the warning is suggesting. What we don't know is what health harms elicit the least psychological reactance or maybe less likely to elicit this unintended consequence. So the objective of this study I'm going to tell you about next is to identify promising warning topics for reducing alcohol consumptions, ones that would be motivating to consumers, and to examine the extent to which these topics elicit psychological reactance. So to do this, we started by creating warnings about 16 different topics. We created warnings about 8 different cancer harms, from generic cancer harms all the way down to throat cancer, 6 different warnings about non-cancer harms like addiction, dementia, and hypertension, and then warnings also about the 2 harms that are in the current US warning, so harms to the fetus and impaired driving. So we created warning statements about each of these different topics, and we vetted these topics and these warnings with a team of legal and epidemiological experts, like folks like you, to ensure that the warnings we tested would be potentially legally viable, could clear some of these First Amendment challenges I told you about earlier, and were scientifically accurate. We then recruited a sample of about 2,500 US adults of drinking age or older to complete an online experiment in January of this year. You can see about half of the sample was female, 2/3 reported drinking in the last month, and 40% reported binge drinking in the last month. We then had participants view and rate 12 different labels. 10 of those labels were warning labels that focused on those topics I just told you about, so cancer or liver disease or dementia. And then they also viewed 2 control labels, which were neutral labels without health harms. The idea here was to get a baseline against which we could compare the warnings, see if the warnings are doing better than a neutral message. And we showed these labels all in random order, so this was a within subjects experiment. To give you an example of what participants saw, this is one of our liver cancer warnings. It says drinking alcohol can cause liver cancer. And one of our control labels, it says, please recycle. This container can be recycled at an approved facility. So something that could be on an alcohol container, but is otherwise neutral, right? It doesn't contain any health or emotional information. So participants rated these labels on 2 outcomes. First was perceived message effectiveness, which was our primary outcome. We asked them, how much does this message discourage you from wanting to drink alcohol? It turns out that this type of measure is actually sensitive to differences across messages. So it's good when you have a big pool of messages you want to compare against each other. And it's also can be predictive of behavior change. So messages that do better on this outcome tend to be more likely to change behavior. It doesn't mean that our warnings would change behavior. It just means it's a good way to sort of sort through and find out when this messages that are more promising. We also measured psychological reactance with one item that said this message exaggerates the health effects of alcohol. So this is one dimension of reactance that's sort of dismissing the message or thinking that it's overblown, and so you're going to discount it because you don't believe it. All right, so the primary outcome was perceived message effectiveness, which I'm going to show you in terms of means for each of the topics we looked at. So starting with liver disease all the way down to our control label at the end there. So our mean perceived message effectiveness ranged from 1.15 for the control, so this is good, it was a very neutral control, up to about 3.1 for liver disease. And you can see that all the warning topics were perceived as more effective than the control. That's good news. We wanted a neutral control. So it suggests that all of these are potentially promising topics. We also saw that the cancer topics shown in red here were generally perceived to be effective. So 6 of the top 8 harms in terms of how motivating people found them were cancer harms. And then many of the warning topics outperformed the topics in the current warning, which are shown here in yellow. So Harms to the fetus and impaired driving both elicited below average perceived message effectiveness and were worse than a lot of the other options. So this suggests that updating the health warnings might be good, right? They might be more motivating than we have right now. All right, so now I'm going to show you how perceived message effectiveness is plotted against reactants. And I know the font here is small, so I'll walk you through it. So first, hopefully you can see this vertical dashed line is our mean perceived message effectiveness among the warning topics. So just to orient you to the graph here, this is about 2.75, and then our mean reactance is about 2.45. So notice first the control message is in the bottom right here. So it's low on reactants and low on perceived message effectiveness. This makes sense. It's a neutral message. It should be low on both. And then notice that the bottom right quadrant is kind of our special place with stars. That's where we want to be. This is messages that are perceived as effective, that are motivating, but that are not eliciting a lot of message reactance, right? That where people aren't resisting as much. The good news is we have 2 harms in that quadrant, both about the liver, which makes sense. People understand that alcohol harms the liver. So liver disease and liver cancer were both above average on perceived message effectiveness and below average on reactance. The current warning topics, fetal harms and impaired driving, are below average on reactants. So people aren't resisting them as much. I think that makes sense. People don't think these harms are exaggerated. We're all familiar with those harms. But they're only doing about average on perceived effectiveness. So they're not doing any better than the average. And then finally, our cancer topics are high on both. So they're more effective than average, but also elicit more resistance than average. So they're just sort of stronger topics in general. So this suggests that we have many viable topics for inclusion in warnings. All of our topics did better than control. The liver topics might be especially promising given they were high on both perceived effectiveness and low on reactants. And in my opinion, the cancer topics are also promising, given that they seem to be really motivating. They're definitely evoking a response from people, even though they're evoking some reactants. So our next steps are to test a narrower set of warnings. So we've narrowed down from our 16 topics down to 8. We're running another experiment. It's actually in the field right now, where we're testing these warnings in a nationally representative sample of alcohol consumers. In addition to testing topics, we're going to be testing different icon designs, because again, warnings are more effective when we include images or icons. So we're going to try to see what icon design is most motivating to consumers, most grabs attention. And that is all going to lead to a randomized trial where we actually test the impact of these warnings on behavior. So to do this, we're going to recruit a sample of about 800 adults, 1/3 of whom will be classified as heavy drinkers using the NIAAA definitions. And we're going to randomize them to a warning label arm or a control label arm. And the warning label arm, we're going to design 3 evidence-based warnings using the results of the 2 experiments I just described. They'll have icons and then simple health statements. We'll rotate through those 3 warnings over the course of the trial, so people will experience new messages week over week. And then in the control arm, participants will get a barcode label like our other trials, so just a neutral image that's already on product packaging. And participants will participate in a 4-week trial. Every week, we're going to ask them to bring their alcohol for the week to the lab. So we're going to say, everything you would normally drink at home over the course of a week, bring that to our lab and we're going to label it for you. So we're going to put these warning labels or these control labels on the front of all their alcohol containers, their beer, their wine, their liquor. And then we're going to have them take that home and drink as they normally would and report on their drinking using text message daily diaries. So we're not going to get the impact on point of purchase, but we will get any changes in consumption once the alcohol has already been purchased. We're also going to have folks report on potential mechanisms underlying the effect of the warnings, usually in weekly surveys, so that if warnings do change behavior, we might have some sense of how they did that. Was it changing the salience of the health harms? Was it informing people, et cetera? And our hope is that this will shed some light on whether warnings can actually reduce drinking, if so, for whom, and if so, how do they exert that effect? All right, so I'm going to wrap up now with some conclusions. Today, I presented research that suggests that public policies can lead to changes in consumer behavior, like reductions in sugary drink purchases. I've also suggested that policies can elicit changes to the food supply that could complement these demand-side changes. And finally, I've suggested that optimizing policy design can enhance equity and effectiveness. So I'll end by reminding you that unhealthy diet and alcohol consumption are leading causes of death in the US, contributing to about 1 in 4 deaths every year. With those statistics in mind, I hope you'll agree it's important for us to continue to invest in research to advance evidence-based policymaking to improve diet and reduce alcohol consumption. Thank you.